everyone, this is Dr. Sahitya Muturaj from Bangalore. I am an orthodontist. You might be wondering, who is an orthodontist? Orthodontist is a specialized dentist who deals with straightening your crooked or malaligned teeth. Okay, you get that? Yes, we are the doctors for braces. And who are eligible for braces? It's just not the kids. Even adults are eligible to go in for braces. And there are a few myths and misleading questions where the kids or the adults are being stopped from not getting the treatment done. I'm here today to clarify those doubts and educate you on the importance of going ahead with the braces or the clip treatment. Let me tell you about why you need braces and when you would need a braces. Usually, we recommend the child to visit the dentist as soon as the first teeth is arrived in the oral cavity. If not, at least at the age of 2.5 years, wherein which all the baby tooth is there in the oral cavity. Every 6 months once, it's very compulsory for the child to visit the dentist. There are certain age-related changes which happens and occurs in the oral cavity, which a dentist can identify it as normal or not normal. When it's going to abnormality, they do recommend for the orthodontist to come and help to rectify that. Okay, so certain times when we see there is an overlapping which is happening during the growth phase itself in the oral cavity, we can start with the treatment as early as 6 to 7 year old. Sometimes we might have to wait till all the teeth, baby teeth is exchanged to the permanent one. So that would be at the age of 14. So this is most of the time it's considered as a misconception when which people think that yes, 14 is the ideal age for the treatment. But no, it's not like that. Each case is different. We need to see the child routine and then we can decide whether it's the right time to begin with or we can delay the treatment later on. Most of the time we come across people where we see there is an overlapping of the teeth and then they are not interested to go in for correcting of the same. This is because people say overlap teeth is a lucky tooth. No, that is not the case. Overlap teeth cannot be lucky, but if you leave that untreated, you're going to lose that teeth because there's going to be a lot of food lodgement in and around the tooth, and then there's going to be cavity, and then ultimately the tooth is going to go for a loss. Save the tooth, and you can save it through orthodontic treatment. There are a variety of braces, namely the metal, ceramic, and the latest one is the clear aligners or the Invisalign. All of them does the equal amount of same job wherein which to correct your crooked teeth, getting them into the curve which you want to smile confidently. Most of the time people think that the orthodontic treatment goes for longer time. No, that is not the case. It depends on individual. It depends on the age, it depends on the growth factors, it also depends upon the quality of your underlying bone and the number of teeth to be moved and the corrections what we need. Usually when the kid goes in for a routine dental checkup, we come across the various problems which is there inside the oral cavity, such as there might be gap in between the teeth, or there might be overlapping in between the teeth, or there might be abnormal sequential eruption of the teeth, wherein which these needs to be a fine detailed correction by a specialized dentist, and we orthodontists are the one who deals with the rectification of these unwanted malalignment or the irregularities which is seen in a kid. It's just not the kid who needs the braces or the clip treatment, but in fact certain teens or even the adults would need that. Sometimes in a very rare case an elderly person would also need an orthodontic treatment. If in case you feel that in your early childhood you were not able to go in for the orthodontic treatment and you feel that this is the age for you to go in ahead and get the treatment done, please do reach out for us. We are always here to help. Do not neglect visiting the dentist on a routine basis. If there are any variations, please do not hesitate to contact us immediately. Saving a tooth is as important as saving a life to us. And every tooth is important to us, like every organ in the body. If you keep the mouth safe, the other parts of the body is safe. Mouth is like the gate to the house. So if the entrance of the house is careful, clear, and the security is good, there cannot enter any robber into your house. So make sure you keep your oral hygiene clean, save the tooth, and save your life. Thank you.